What do we really know about heme iron? Good question. One way to find out is to review published medical studies in the most important journals. Here is a selection of these, and as you will see, heme iron and supplementation with heme iron has a good scientific standing. My name is Michael Collond, and I'm the marketing manager at Meditech Group, working with the Optifa Natural Heme Iron Supplements. 1. Heme iron is always absorbed. Critical Reviews in Food Science and Nutrition is an academic journal published monthly, which is indexed in Medline and PubMed. Here's some quotes from the study. Effect of tea and other dietary factors on iron absorption. Heme iron is absorbed by human duodenal mucosal cells in a specific uptake process, which is not influenced by extrinsic factors like phytates, calcium, or oxalates. The two different absorption pathways are complementary and additive. Heme iron will not desensitize mucosa cells like non-heme iron. It will be absorbed, for instance, during proton pump inhibitor antacid treatment, as opposed to non-heme. What this means is, for instance, that other simultaneously ingested food, drink, or medication, specifically proton pump inhibitors, have no effect on heme iron uptake. 2. Losec and other proton pump inhibitors stop the uptake of non-heme iron, but not heme iron uptake. This is from the journal Gut in PubMed 2007. PubMed comprises citations for biomedical literature from Medline, life science journals, and online books. Here a quote from the study: proton pump inhibitors suppress absorption of dietary non-heme iron in hereditary hemochromatosis. Conclusion: administration of a proton pump inhibitor to patients with hereditary hemochromatosis can inhibit the absorption of non-heme iron from a test meal and the habitual diet. Low iron counts, and even anemia, is often found in patients using proton pump inhibitors, such as Losec or omeprazole. These drugs make stomach content less acidic. A lowered gastric acid pH effectively stops non-heme iron uptake. 3. Heme iron uptake is independent. Here a quote from the journal Biological Trace Element Research. We reported evidence that heme and non-heme iron as ferrous sulfate does not compete for absorption. The mechanism behind the absorption of these iron sources is not clear. Heme iron tablets often contain both hemoglobin and non-heme iron, such as ferrous fumarate or ferrous sulfate, since the hemoglobin raw material is voluminous in comparison. Heme and non-heme iron will, however, not interact or compete for uptake or efficacy. In fact, they complement each other. 4. Heme iron uptake does not compete with non-heme iron uptake. This is from PubMed 2012. Pathways of iron absorption. Our objective was to investigate the potential competition between heme and non-heme iron as ferrous sulfate for absorption when both iron forms are ingested on an empty stomach. 26 healthy non-pregnant women were selected to participate in 2 iron absorption studies using iron radioactive tracers. We reported evidence that heme and non-heme iron as ferrous sulfate does not compete for absorption. In the literature, mechanisms for both organic heme and inorganic non-heme iron uptake are well documented. The special pathway through which heme iron is absorbed has great benefits, mainly because the uptake is substantially higher. Since the hemoglobin molecule is absorbed as a whole, no free ions are released in the intestine to trigger disturbances. 5. Heme iron can increase the quality of life. Heme iron-based dietary intervention for improvement of iron status in young women. Nutrition. 2013. Objective: conventional iron deficiency treatment with pharmacologic iron doses often causes side effects. Heme iron has high bioavailability and a low capacity to cause gastrointestinal side effects. This study investigated the possibility of using heme iron in the form of blood-based crisp bread as a diet-based treatment program to improve the iron status of women of reproductive age. Conclusion: dietary-based treatment containing heme iron has few side effects and can be used efficiently to improve the iron status of women of reproductive age. Heme iron tablets typically have a tolerance close to placebo level, whereas non-heme oral iron has a therapy failure rate due to side effects of around 30%. Heme iron products have the potential to complement anemia therapy. This would mean substantial savings for the community and a much improved quality of life for the patients. 6. Heme iron works well with children. The American Journal of Clinical Nutrition is a monthly peer-reviewed journal that publishes research on nutrition and dietetics. Our objectives were to produce heme iron enriched in 58Fe and to use it to study the absorption of heme iron and the effect of iron and zinc intakes on heme iron absorption in children. Heme iron works well with children and is absorbed to a greater degree than non-heme iron. It will also not inhibit zinc absorption. The Optifa series of natural heme iron supplements is based on bovine hemoglobin with a high content of natural heme iron. Take care of your iron levels and live your life to the fullest with Optifa supplements. Find Optifa at Amazon for quick and easy delivery. Anywhere.